Hello people, today I'm going to talk about what it is that we do as specialist therapists. Now I can talk from both sides. I can talk about being a therapist and I can talk about being a patient with somebody with a terminal illness who's now receiving treatments a lot differently than how I received treatments when I was in my full health, and about the benefits from it as a patient, as a client, and also as a therapist and somebody that's developed the oncology massage course. Now, just because it's an oncology massage course doesn't mean it's just for people with cancer. It's for people with any types of what we call contraindications, and that's health things that would make us stop and think, okay, we need to maybe adapt that. Now, as a client, you'll think, what is it that we need to adapt? So this is what I'm going to explain. So what you can expect from a specially trained therapist. So we know firsthand all the worries and the physical and mental symptoms that are part of having a condition, whether it be cancer, life-limiting conditions such as arthritis, lung diseases, neuromuscular things, the list goes on. So what you can be assured of is that if you have a specialist therapist that's been trained by Start With Touch, that they will focus on you at every stage of your treatment, from the consultation right up to the end, to your aftercare, to your home care, to giving advice and referral processes and such on. So how exactly will your treatment differ from maybe massage that you've received before? And you're thinking, oh, is it going to be light and it's going to be all like tickly and things? It is not. We do have to have some adaptations, and some of these adaptations are about pressure, but we use a technique called full hand technique, where it would be the full hand on you, and even if it is just pushing down till it reaches the first muscle barrier, now we call that level 3, we go obviously 0, 1, 2, 3, 4, 5, 5 being deep tissue. So level 3 is where we just meet the muscle. So that's going to be a safe touch for everybody. If you think about it, when you're in the shower, you're washing yourself, aren't you? So you're washing yourself like that quite vigorously. So our massage is not going to be any deeper than that at all. We also watch for things reddening up and things, signs on the skin where we would say, okay, that's maybe enough in that area, because you've got other things going on. So the therapists are trained to know all this and to look, so you can be rest assured that your treatment is going to be really, really safe. But first of all, before you even get up onto the couch, or even if you're not even going on the massage couch, you might even just want to sit in the chair and, oh, do I have to take my clothes off? No, you actually don't. You can receive a treatment with it, taking your clothes off. You could get hand massage, head massage, facial massage, foot massage. You can even get body touch through clothes and put blankets over you, and we do a restorative touch where it's lovely stroking, or it can just be holds, and we maybe talk you through a guided meditation and using your breath to help relax you. So there's lots of things that we do on the Start With Touch massage course for dealing with contraindications. It's not just all about massage, it's about putting all these different ingredients in to get the perfect treatment for you. So your treatment will differ because it's going to address what I call the big 5. Now these are typically, now not exclusively, the main concerns of what we see a lot of the time from side effects from treatments such as chemotherapy, radiotherapy, drugs that you might be on long term like steroids and autoimmune disorder things, and these new biological drugs, all these different side effects that happen. So the big 5, what are they? So we have anxiety and depression, we have sleep problems, we have energy level issues, and then of course we have stress at home, stress at work, and then there's lots of other things like nausea that come into it, maybe stomach problems, constipation and things like that. So what we like to do is we'll ask, what is the biggest concerns that you have with your symptoms, and we can audit these. We like to do this on a scale of 1 to 10, and we'll review it after every treatment to see if we've made a difference in these. Now, I'm pleased to say I've been involved in studies right from the beginning, over 20 years ago, but back in 2006 I was working within a hospice environment, and we had patients and carers coming in and receiving treatments, and we significantly reduced the levels of stress at home and work, their pain levels, their anxiety, depression, improved their sleep quality and their energy levels. And that was a sort of documented study that we did along with other hospices and university. But as therapists, we do this with our consultations, and I'm very lucky to get people's case studies in for doing this course and see the difference that we've made. So I am actually going to put up a graph of what we've did in the time that Start With Touch has been in going and teaching this course, and reducing people's pain levels and anxiety. I mean, just doing the part of our course, we have a bolstering thing. Oh, here's my little bolster till I show you. I probably showed you on loads of videos. This is just a simple scarf here. I'm leaning forward at the moment because I've not got my pillow here. My pillow is actually in the car because it's perfect because I have a bit of, I don't know if you can see, I have a bit of kyphosis. So you can see my neck goes in there, so I've got this gap. So it puts pressure on my spine, and I live with broken fractured bones as well. But if I put that in there, so I've got to actually put my head back a little bit, it fills the gap. So if I'm lying back, it takes the pressure off my spine. Now this is also part of our course that we do. So other things that you might be worried about, me personally, a big thing for me is hygiene. So maybe you've had recent surgery, or you've been receiving therapies such as chemotherapy or radiotherapy, and it's put your immune system at a real compromised situation. So I live like this. My immune system is very, very compromised because of the medication that I'm on. So we have strict infection control procedures at home. Nobody gets by the glass door without having any kind of PPE on, and we have a no shoe zone policy. If you think about it, the feet and your shoes are outdoors, so to bring that into your house is bringing infection and dirt into the house. So my house is very clean, dust free because of my breathing. I have a cleaner that comes in twice a week. So this is how I live. So it's not normal, and again, if I wanted a therapist to come and give me a treatment, I would have a fear of thinking, oh, how would they know like what my control procedures are? Usually when I've got anybody visiting, workmen or anything like that, doing the checks and machines and things, I have to say on the phone at the time, look, I'm an immunosuppressant here, it's nothing at all to do with COVID. We were doing this well before COVID. Anybody that enters must, not have any kind of colds or anything like that. So be rest assured that your therapist definitely wouldn't come near you if they had any kind of infection or had been with somebody that had infections and maybe a person that could carry it. So that is one of my worries, and it's something that I've got over because I'm constantly sort of interviewing people as such when they're trying to make an appointment to come and see me. So that is something that I worry about, and it's probably things that you will worry about as well as the infection. So all our therapists are trained not to work with people with compromised immune systems. If they feel unwell or even just feeling a little bit under the weather, they would reschedule that appointment. To wear PPE as necessary, whatever you feel comfortable with, or whatever they feel that they would be necessary to work with you. And also, I don't want to be using somebody else's towels that hadn't been laundered, you know. I want to know that my therapist has washed the towels clean and they've not just come from somebody else's back and she's turning it round. So be rest assured that all our therapists know that everything should be laundered. It should also be laundered for any kind of client. You shouldn't be using anybody else's towels whatsoever. But for people that are immunocompromised, sometimes we would use bedroll and that would get changed, but the whole bed would get changed. The whole couch, massage couch, would get completely changed for every client, and all the laundry would be done at 60 degrees plus, so that it would be washed, and be using disposable things such as couch roll, face covers, spatulas, and strict hand washing procedures also. So the hand washing procedures, where we always say wash with soap and water. It's much better than the antibac gel, which is fine, but if you've got access to a sink, please use that. There should be no surprises during your massage. The consultation process is the time to talk about things, so the therapist might also inform you that she may need to wash her hands during the treatment as well. So she might be working on your feet and then going to work on your face, so she would want to wash her hands before she went to work on your face. And during the treatment she'll say, I'm just going away to wash my hands, if she goes to the bathroom or access to a sink, or she might use the hand gel and she maybe just say, I'm just going to break contact just now just to give my hands a little wash. But she would have said to you during the consultation process, so there shouldn't be any surprises at all. And that's something to say. If you go into any salon, whether you have health concerns or not, if you are not getting a consultation, about turn. Out you go, because you will not get a treatment that is specific to you. One, they shouldn't be doing it anyway, because your consultation is part of the treatment. It's part of something that you need as a contract for insurance purposes, and a contract between you and your client to say that you've disclosed everything and that they are going to adapt the treatment however, and tell you what they're going to do for your treatment. So it is a contract. So it doesn't just provide us with medical history, but it I'm tripping up on my words. It provides us with your likes and dislikes, and it's all about you. It really, really is. On our consultation forum, we have a little picture of a wee man, or a wee woman. It's just a body picture, and you can put X's on it and say, I don't want to be touched here, or I've got a trauma here, or this is where I'm getting treatment here, and you can tell us all about it. So don't live in fear about thinking, oh, I'm going to get on this couch and she's going to go and touch this area, or I can't lie on my back. So we've also got a bit that says, what position would you like to be treated in? And we've got other things like chairs, and even just sitting on a normal chair leaning forward, or we've got a specific massage chair, or just your own chair, your special reclining chair. It might just be your bed that you want to lie in. You're getting a home visit. So a lot of the time we do home visits. Home visits are really, really good for us, for me. I mean, I don't go out, because I made the choice not to go out from picking up infection, and I only have 23% of my wee lungs left, so catch another infection. I mean, I had one there, and almost died again, but I'm still here. And that's why I'm challenging on to really just scream and shout about these treatments, because if it wasn't for them, I don't think I'd be alive. I really don't. I mean, as much, obviously I'm taking all the medication as the doctor prescribes, but I take much less pain medication than I probably should, because I'm receiving these complementary therapies. And I'm 4 years on now. I was given a year to live. So I mean, I'm walking, talking it. I always have. I've always walked and talked the game. When I was a therapist, I always went for treatments, and you know, I love aromatherapy. I make up my creams. I do my treatments on myself, my husband, if he's lucky. But I'm not so well now to do hands-on treatments with any pressure, but I'm more energy treatments because they're lighter for me. So the restorative touch and the bolstering and Reiki and crystals and things like that are all very good. And it's amazing how we can massage just by sort of moving your body, but a moving gets me a little bit out of breath. Anyway, I'm going off topic. Well, I'm not really, because I'm advocating about how wonderful receiving a treatment is for your health. It really will. We've got the science behind it as well. We've got the research behind it, how much it can reduce the symptoms that you're going through. So in the consultation, after it comes down to what we call the app box. Now, you obviously you can see this, you have rights to see your consultation, but that stands for avoid, position and pressure in this little app box. So it would be areas we would avoid. We take the concerns that we've had medically, turn them into massage concerns. So for instance, if somebody had nodes removed, we'd sort of avoid draining towards that area. We'd work towards the working nodes, and we maybe wouldn't have the arm hanging off the bed. We might do some elevation, and we would do what we call the riscal lymphedema routine on that quadrant. So that would all go into the box, and the pressure wouldn't be above that level 3 that I showed you. And the positioning also would be whatever would be comfortable for your client, depending on where they were. They might have just had the nodes removed, so maybe side lying on this side would be good, and then bolstered, you can get a nice big teddy bear bolster to cuddle round, and oh, it's absolutely beautiful. I might put some pictures up of the bolster and show you what it's like. But generally, when we do home visits, so I always encourage the students when they do home visits to show the primary caregiver how to do the bolstering, because it does take the pain away. I mean, it really does. I just showed you that in my neck, and it takes the pain away from my spine. So just filling the gaps with this towel origami is great. And also you something that may happen too is if your therapist is doing a home visit, they may ask you to look out your towels and things. It's not because they don't want to do the laundry, it's because they're going to do these bolstering techniques, and sometimes you just want to be left like that. So you can just be left and not get them all pulled out and things like that. You can just go to sleep after your treatment. So that's the reason that we might ask you to say, look out your towels. They don't have to be fancy towels whatsoever. Any old towels will do. And it's just to leave them and leave you in that comfortable position. I think I've sort of explained most things and most worries that people might have. If you're feeling nauseous, if you're having a day where maybe you've had your chemo and you're feeling really sick and things like that, you definitely wouldn't be going into a salon, and you'd probably want to cancel the appointment. But if you're having a home visit, still take it, because the therapist can come and work with you, even with the nausea, can maybe help take it away. If they do aromatherapy, they can maybe give you a little bit of peppermint to smell and leave you with that, maybe make up a little aroma stick for you. But just do a little bit of guided meditation. Definitely not any maybe stroking, because that might make you worse. So they can definitely do something that probably will help you, your nausea. So I hope I've encouraged you and made you feel a bit better about booking an appointment. So we've got a list of people that I'm adding to now. This is a very new page, and this video is probably older now, but we're adding to the therapist all the time, and I hope somebody's in your area that you can book. But all start with touch therapists are trained this way. I'm not saying all oncology massage therapists are, because I've been doing this a long time, and my course is very, very developed in the sense that it's not just an oncology course that the therapists learn to do a routine. It's not product based either. They learn how to adapt for risky lymphedema, risky DVT. They get taught restorative touch. They get taught how to do pressure control and use their normal massage techniques. They get taught how to adapt the other therapies that they might do also, whether that be beauty, reflexology and things like that too. So it is the best of the best oncology massage course, and for any contraindications it covers absolutely everything, and it makes sure that anybody can get a treatment at any time, apart from one thing: if you've got hot seeds, and that's a radiotherapy thing, but you would be in the hospital and you'd be radioactive, so that is the only time. We are very, very inclusive, and I hope that you can book something to help you feel better. It really will help you to take back control of your own body. We also have other courses that you can do, like the self-healing crystal course, so have a little look at that if you're sitting there, because I know what it's like. I get to the point where I'm feeling pain, I'm feeling cranky, but then I start to do work on myself, and then I've got an appointment booked for somebody to come and do work on me. But learning how to do some work on yourself is really, really good. So even if it's just going on YouTube and finding some guided meditation, that's what it's all about. So I hope that you can just do something to help yourself and make you feel better today. And then let me know how you get on, please. Send me a message. It just gives me so much joy to hear that people are getting the benefits from all this.